We're going to go right back to our Toyota of Easley guest line, back-to-back interviews, and glad to be able to bring Dr. Rod Walters in right now. Of course, Dr. Rod Walters, the first thing I will tell you is that we're not going to sing to you, but we are going to wish you a very happy birthday.
Oh, my goodness, you guys aren't supposed to know about all that kind of stuff.
We do know, and we know exactly how old you are. And and you know, listen, it's okay to be 84. It's all right. It's not a big deal. And you know, they say that 84 is the new 55. That's what they're saying out there.
I hear you.
On the
That's
street.
good. That's good. I tell you, I was on the way. I've been at a meeting over in St. Louis, and I was going to the airport early this morning, and have a cab driver sing "Happy Birthday" to you was kind of eerie, but it started the day off good. But thank you much.
Nice. Very cool. Very cool. Well, Dr. Walters, as you know, right now in the NFL and what you do now, being with the consultants in sports medicine on the collegiate level as well as all the way up to the National Football League, there is not a day that goes by that we do not see an article that comes out about concussions in the NFL. And, of course, at the Rookie Symposium this past weekend, you know it was number one on an agenda list to be able to address with the rookies out there. Just talk us through what that looks like for you in your life right now as this has become such a major focal point in the National Football League.
Well, I think it's a focal point with anybody that's in sports medicine today. I think that I look back on my career and the time that what we did with concussions and grading concussions and treating concussions, and now, you know, it's just that I think we know so much more information today that we didn't used to know, and it's basically we're finding out that things that we did not think affected recovery as much are certainly affecting it now. And the bottom line is, as long as a patient has symptoms, we got to treat that. And you know, no two concussions are the same. And I mean, we're seeing them in all sports, and it's just a major concern because of the complications long term.
What do you think about, Dr. Walters, this is Will Boughton here. We're speaking with Dr. Walters, Walters, Inc., consultants in sports medicine, helps the National Football League and a lot of college football programs figure out concussions. So with players passing, and, you know, Dave Duersons of the world, Junior Seau's, and the families being willing to donate their brains to science, how important is that for your field?
Well, I think anytime they can find out any information that are indicators, every place that I go, when I talk to colleges and universities, when I talk to neurologists, when I talk to neurosurgeons, when I talk to baseball, whoever I'm talking to, every research body in the world is trying to find a predictor. They want a biomarker that can predict concussions, and we don't have one. I mean, there's no blood test. There's nothing right now that we're seeing. So the bottom line, and if I get going too much here, guys, cut me off, but the bottom line is today, you know, the best practices are showed that we can do neuropsych testing, we can do neurophysical testing, and we can check graded symptoms checklist, and these types of things as a baseline and then as a return to play decision. We need to be objective. We need to not say, it looks like he doesn't have a concussion, but we need to do tests that gives us objective data. And I think that's what's really changing today is how we're treating these, how we're assessing these, and how we're educating parents. I mean, we're educating the parents. We're educating the student athletes. We're educating coaches more. And that is so important in this approach and this strategy to treat these things.
Dr. Walters, let me ask you this, and I know you're going to be down at Hattiesburg in just a couple of days at a concussion management workshop, and of course this will be, these type of workshops are exactly kind of what you're talking about. They're going to have to happen in order to be able to start to facilitate some of these changes. I want to simply ask you this. What about the guy that calls our show? What about the guy you see at the water cooler? What about the guy you see at the gym that says, I don't care, I want to see the big hits. I don't care, I want them to lead with their face. I don't care, I want to see the highlights on SportsCenter. What does that do to you? I mean, what is your reaction to when you hear those type of comments?
Well, I'm a fan. Now, listen, I don't, you know, football is a contact collision sport. We all understand that. And I don't mind the contact as long as the patient's protected. If they have concussions, they need to be treated with. And I don't think we can correlate big hits always with concussions. That's a misnomer. You know, all these companies are out there today selling these devices that tell you how many G's you're pulling in this helmet or how many this mouth guard. It has accelerometers and all these physics phenomena. They have all this equipment in there now. That's not important. What's important is that they have concussive symptoms. So the fact that they got hit is one thing. There's a study that came out recently, and I saw some data from it, and it was talking about the magnitude of these hits. Again, these big, large hits. The big, large hits many times are not where the concussions come from. It's those many moderate hits. So the point is we got to look at concussive symptoms and not be as concerned about force. I definitely, I think that, I've said a long time, way before all this concussion language came out, if we changed the rules and took the face mask off the helmet, we'd stop head and neck injuries because players would not stick their face into that. The equipment right now is definitely a protective device. I mean, the helmet was developed not to prevent concussions, but to prevent skull fractures. So, we had the face mask to take down facial trauma. The mouth guard is to help dental trauma, and they've done a good job on that. But we have to remember that the helmet itself is not to prevent concussions, but more trauma there. So, I think we just have to be cognizant of that.
Dr. Rod, and Dr. Rod, just by the way, when you do decide to take the face mask off, I just want you to know I will become an orthodontist. The following week, I'm going to become an orthodontist.
Well, that's the question I had, Dr.
I don't think that's going to happen, guys. I'm afraid I don't think that's going to happen.
Yeah.
So what is your opinion, Dr. Walters, on what should happen to help make the game safer, if anything?
Well, I think we got to continue to educate. I think we have to educate. I'm not a big fan of sports agencies making medical rules and medical guidelines, but the reason why the NCAA established a concussion plan or mandated they have a concussion plan at each institution is because institutions were being sued because they didn't have a plan and because patients weren't seeing doctors at some of these schools. So, it's to me amazes me when we have to try to legislate common sense. But I think the best thing is going to be the education programs. We establish these baselines. We have return to play decisions now, and we have we're talking to the athletes, and we're not letting them return until they're cleared. Let me tell you another study that's really interesting. They went back and reviewed concussion patients in this one study from 2005 to 2008 in this one practice, physician's practice in this group of data. They found that 41% of the athletes returned to practice too soon. 41%. So the point is, the patient has to tell us what's going on. The physician has to listen, and you have to be objective about that. We did baseline testing this year on professional baseball umpires in the major leagues, and we established baselines on these guys. So now when they get a concussion, they see the physician, he does their test, he does a neuropsych test. Now we've got baseline data that we can go back and compare them to and look at it, and we do these tests, and it tests all these systems in the brain so that we can make an objective, informed consent. So I think that we're